October is National Breast Cancer Awareness Month, and in support of this devastating disease, I want to learn more about it with you. So I have a nurse practitioner that's going to talk to us more about this disease, and also we're going to hit the streets to find out if some everyday women really know their breasts. Joining me on the show right now to talk about breast cancer is nurse practitioner Camille Payne. Camille, thank you so much for joining me on the show.
Thank you for having me, Jess.
You're welcome. So how about you tell people a little bit about yourself?
So I am a nurse practitioner by training, and I'm presently employed at the breast center in the Smilo Cancer Hospital at Yale, New Haven.
Okay. And in this department, you deal with breast cancer and the diagnosis portion, and you walk people step by step through it, the process, correct?
Absolutely, and we also have a segment of our patient population that are high-risk patients and patients who are concerned about a new finding in their breast, and sometimes it turns out to be something, and then we inform them that we are a comprehensive breast center that's able to deal with all of that, but there are times where they're just getting preventative care to understand how to go on to care for themselves moving forward.
And see, that's actually the portion that I want to focus on right now, the preventative action that people can take. Because as I was preparing for this episode, I was doing lots of research and came across information that I never knew before. And it told me that you could actually do certain things to prevent it, like exercise, or there's the BRCA testing. So can you tell us a little bit more about different things that we can do?
So in terms of breast cancer prevention, what you have to understand is that there are different levels of prevention. There's primary prevention, which is how you stop something from taking place in the first place. And then secondary prevention is how, having had an illness, how do you prevent further deleterious effects on the body. So as far as breast cancer is concerned, no one can absolutely stop you from getting breast cancer, but there are things that you could do to statistically reduce your risk.
Okay.
Some of these things from a lifestyle standpoint include having children. Pregnancy is protective.
Okay.
So we encourage women that if they're going to have children, to try to have children before the age of 30.
Okay.
Because what we see is women who have not had children or who have delayed having children have a slightly increased risk
Really?
for breast cancer.
So having kids can help you be more healthy.
Yeah.
Hear that, ladies? Having kids is good.
The other thing that we counsel women on is as they get older and near menopause, we encourage them, if at all possible, to not use hormones after menopause because those things are breast cancer risk increasers. Other things that women can do, they can manage their alcohol intake by making sure that they're not drinking more than 4 drinks in a week, 4 alcoholic drinks.
Okay.
And managing your diet to keep your weight down as well as exercise.
Okay.
Those are other things that women totally have control over in terms of managing their breast cancer risk.
Okay, so all of these things, just keeping yourself healthy and moderation, doing those things will help in terms of the alcohol and exercising. Okay, so what about other things? Because I've heard of this thing called the BRCA testing. Is that something that most women can do, or?
BRCA testing has gotten a lot of attention in the past few years as far as breast cancer care is concerned. It is not a test for everyone, but certainly it's very useful information in people who have a high family history, multiple family members with either breast or ovarian cancer. That could provide additional information in terms of caring for them and managing their risks going forward.
So it's helpful for us with family history to get that testing. So just not the normal person, or not person, woman who says, oh, I just want to check, they're not going to probably allow her to,
Right.
unless she has family history.
Because the test is done in the context of genetics counseling.
Okay.
So a genetics counselor is going to look into your family history, see how many people you have who are either first or second degree relatives to you who have had breast or ovarian cancer.
All right, good to know. So as you can see, it's important to take care of your body. There's different things that we can do to prevent breast cancer. So don't go anywhere, because up next, Camille is going to talk to us about how to do a self-breast exam. And also, in between the show breaks, I have some hit the street moments with some everyday women to see how well they know their boobs. So we'll be right back. So, do you know your boobs? Do you know your boobs? So tell me, who knows their boobs? So ma'am, do you know your boobs? You know your boobs? Are you checking your boobs?
I would hope so.
I do.
Oh, yes.
I think I know my boobs, honestly, more than most people do.
I know it's a silly question, but you know we gotta know our boobs. For breast cancer, you should check them. Do you do yours? Self-breast exam?
Okay, so I don't do it deliberately. I do feel them sometimes though, but
Do you do a self-breast exam every month?
You do.
I do. Are you checking them, doing the regular self-breast exam?
yes.
Just, touch it.
Okay. All right, so you're familiar with it at least. Okay, what about you?
No, I don't ever
Never.
take an exam on myself. No, I don't.
So Camille, what is the proper way to do a self-breast exam? I know this is something that women can do to try and keep track of their breast health.
So self-breast exams, there's been a lot of debate regarding them in terms of their utility from a clinician standpoint, but my take that I advise my patients is you're with your breasts every day. You might see your healthcare provider once or twice a year, depending. So I'm definitely a big advocate of self-breast exams. I encourage women to do their self-breast exams for women who are still in their reproductive years, and that means getting your period every month, to do a breast exam 7 to 10 days after the start of your period, and that's the first day that you get a bleed.
Okay.
And the reason why we say 7 to 10 days is because at that point in your cycle, the breast tissue is a lot less tender, and you're better able to appreciate what are normal changes in your breast, as well as if there's something that's there that's new. So it's all about getting to know you and knowing what's there and knowing what's not there.
Right. Now, let me ask you, in terms of exactly how to do it, because I have seen ways where you can start from the nipple and go around, or start from like left to right, going up and down. So what ways do you explain to your patients?
So there are different ways that you could do self-breast exams. You're right with starting at the nipple, where you have concentric circles and you're covering all of the breast surface area, and making sure that you're also getting up into the axilla or the underarm area, because there's breast tissue there as well. The other way that you could do it is the vertical stripes, where you're going up and down the breast, trying to get an appreciation for the tissue architecture that way as well. And then the other way is like cutting a pie, where you're taking the breast tissue in segments. The thing that I caution patients to make sure is that with this, that you're overlapping, so that you're covering all of the breast tissue, as any good clinician does during a clinical breast exam.
Okay. All right, and either one of those ways is perfectly fine, whatever a woman is more comfortable with, correct?
Absolutely. What we do see is statistically women who have the vertical exam done, there's a higher detection rate with that.
Okay.
But either of them are useful in helping you to get familiar with your breast. And the other thing we counsel patients is to make sure that it's being done in 2 planes. And that means either sitting or standing up.
I was just about to ask you that.
Yeah, sitting or standing up, and also lying down. And we ask women to raise their arm to the back of the head, as the muscle stretches out the breast tissue, and you're better able to appreciate what is there, as opposed to if the tissue is compressed.
Okay. Whew, that was very helpful. Thank you. That was good to know. So you guys heard it yourself how to do a self breast exam. So I hope you all take the opportunity to do that every month. You said 7 to 10 days after your period, correct?
Yep. And I wanted to add one more thing.
Sure.
For women who are no longer getting their period, meaning they're in menopause, all they can do is pick a day of the month that they can remember, something that's significant to them, the 10th, the 15th, whatever works, and then use that as the day that they check their breast, because they're not going to get the trigger
Got
of
ya.
a monthly period to help them remember.
Okay. Thank you for that. So don't go anywhere, because up next we're going to talk about what happens after you do a self breast exam and you happen to see something that's abnormal or possibly feel something that's abnormal. So Camille's going to explain to us what we do after that. So we'll be right back.
But why don't you, if you don't mind me asking?
I don't ever think it's a issue unless I like feel something or see something different, then I won't check it. I mean, I see commercials, but I think it's for like older women, so I don't really think it's important, but I guess it is.
I'm still out here on the green, and I came across this beautiful couple. Look at these beautiful roses this man got for her today on her lunch break. That's what I'm talking about. Men, take note. All right, enough about this. It's not a relationship show. So, what are you guys thinking about breast cancer? You know, are you checking your boobs? You know, because it's a topic and it's an issue that is very prevalent. We all know about it. So, as a woman, are you checking your boobs?
Most definitely. I'm very cystic. Is that the word cystic?
Yeah, I think so. I mean, I have a sister.
Very dense, and it's hard for me to tell what's what, but I stay on top of it, and I get my mammograms on a regular, and I make sure that, you know, if it doesn't feel right, then I'm always going to the doctor. So I'm not prone to not going, because I know the importance of it.
So excited to be doing this episode this month about breast cancer. Breast cancer is dear to my heart because it runs in my family, and also back when I was 21, I had a breast cancer scare. And it was then, once I went to the doctor and discovered that all I had was a cyst, that I started to learn as much as I could about breast cancer. So I hope that today you are taking away something from this episode, because it's so important for women all over the world to know more about breast cancer and how it affects us, what we can do to take care of our bodies, and just good to know our boobs. So I hope you're learning a lot today. We'll get back to the show. So Camille, we just got finished talking about how to do the self-breast exam. So when a person does that, well, woman, when she does that, and she feels something or sees something abnormal, what are those things that she should be looking for to see or feel?
So one of the things I wanted to clarify is that certainly, yes, finding or seeing a change in your breast can be very alarming, but not everything that you see or feel is going to be cancer.
Right.
There are a lot of different things that women may feel or see in their breasts that are really common benign conditions that women may experience, such as cysts, which are fluid-filled sacs in the breast, or fibroadenomas, which those are common benign tumors in the breast that women get, similar to how women make fibroids in their uterus. A lot of women are familiar with those, that those, they kind of get in the way and they might cause some pain or discomfort, but they don't harm you. They can't spread to other parts of the body. And fibroadenomas are the same way in the breast.
Okay. So what do some of these things look like? Because I see here you have a chart for benign breasts, which is not cancerous.
Okay. So cysts, as I told you, these are sacs in the breast that are filled with fluid.
Okay.
That fluid could be different colors. It could be green, it could be brown, it could be blue, you know, but...
And this is this right here.
Yep. And women can feel that by examining their breast, but like I said, it doesn't mean that it's cancer.
Okay.
Fibroadenomas are more solid tumors in the breast, but they don't have the ability to spread or to harm you.
This is here, right?
Yep. Okay. Something else that women might see in the breast is nipple discharge, even at a time when they're not pregnant or lactating. And as far as nipple discharge is concerned, we are not concerned about clear nipple discharge, but we do get more worried about bloody nipple discharge, whether or not it's indicative of something that we call an intraductal papilloma.
Okay. Now, what about the infection and inflammation? Now, is that the one where you'll actually feel like heat on your breast? Will that be an indication of possible infection? Or?
Yep, when women feel increased warmth and redness in the breast, that's usually some of the signs that are indicative of an infection in the breast.
Okay.
And that's a nice plug for me to encourage women to stop smoking, because when women smoke, they have an increased risk of developing infections or abscesses in the
Really?
breast. Absolutely.
Okay, I didn't know that.
Yeah.
Wow, okay. This is good to know. So, there's so much that can go on with our breasts that is not cancerous. And even the lumps that we feel can be these things right here, the benign, I'm going to mess up the word, but the cysts and then the fibroadenoma.
Fibroadenomas, yeah. And something else I want to touch on in terms of tissue type. I know that we've gotten a lot more publicity in the media regarding dense breast tissue.
Yes, especially in young women.
Absolutely. Dense versus fatty is how breast tissue is categorized.
Okay.
Where dense breast tissue represents more of the glandular tissue in the breast. And women who are younger usually have dense breast tissue, or women who are thinner and have a lower body fat proportion usually have dense breast tissue.
Now, when you say thinner, does it matter if you're like a size A, double A, or a D?
When I say thinner, I mean your overall body fat.
Okay. But also, is it good to know, because I've had, friends say, man, I don't have any boobs, they're so small. But that doesn't mean you shouldn't check, correct? Because it doesn't matter the size of the breast, you can still get breast cancer.
Right.
Okay.
And it's also the same story for men. Breast cancer is more common in women, and we have a smaller patient percentage that are male, but men can get breast cancer as well. So.
Okay, great. So now we're going to move on to breast cancer. So don't go anywhere. We're going to talk more about what it means when you have breast cancer and what you can do. All right, we'll be right back.
So what about you? You caring about this lovely woman, do you ever encourage her, or maybe some of the other women in your family, do you encourage them?
Yes, well, I encourage Deidre to go to the doctor and all that good stuff.
He stays on me. Just before you walked up, we were talking about the doctor's office.
Really?
Yes, we were.
See, that's a good man. When you love people, you have to, help them take care of themselves too. Whoever we love, we help take care of each other, right?
People I know, because I do travel a lot, most of my girlfriends or even just random people, they don't really care too much. I actually just had a friend who just recently found a lump in her breast, and she actually had to have surgery and get it removed. And it's not cancerous or infectious or anything, but still, that's a good reason why you should always check.
Right.
Always check, because you never know, because if it pops up that quickly, hey, you don't want that. You really don't. But
Exactly. And I think maybe that might be for some of us a fear.
And we're back talking about what the actual breast cancer looks like in a breast, and also how do doctors diagnose that. So Camille, talk to us a little bit more about how does a person know for sure that they have breast cancer? Like, what do doctors do to diagnose that?
So we talked about what happens when a woman feels or sees something abnormal in her breast. The next thing is you come into your healthcare provider, and the tests that are used to confirm whether or not something abnormal is going on in the breast is either a mammogram, an ultrasound, or an MRI. And it could be either of those, or they're used in combination. When something abnormal is seen on either of those imaging modalities, the next thing that's done is a biopsy, because no one gets diagnosed with breast cancer just based on imaging. It's done with tissue confirmation to say, yes, these are cancerous cells.
Okay. Now, and also those three things you named are also used to rule out benign breast conditions.
Absolutely.
So it's these tests that allow them to tell the difference between cancer and benign, but then to really determine that it's cancer for sure, there must be a biopsy done.
Absolutely.
Okay, that's clear enough to understand. Okay. So, tell us a little bit more about this treatment of breast cancer. I know off camera earlier we were discussing family history and how important that is when it comes into breast cancer treatment as well.
So one of the things I encourage patients to do is to get in the know. You need to know your family history, and I think that it's important for us to remove the mystery and the myth surrounding health conditions. I know when people hear about cancer, the big C, it's very scary and no one wants to talk about it. But if you inform your family members of what's going on, one, they become informed of what they're at risk for. And the other thing that happens is you open up a supportive network where people can be there for you in meaningful ways. And that's equally an important part of the journey in terms of the care that we provide to patients.
Okay, and also let's look at this chart, Camille. Tell us about just understanding it, because I see you have stage 1, stage 2, and I hear that often. Some people, by the time doctors discover it's at a certain stage. So let's talk about this.
So I want to start by talking up here about the earliest form of a breast cancer, which is an in situ cancer, or you might hear people talking about DCIS. So DCIS, which is a ductal carcinoma in situ, is the earliest form of a breast cancer. It's when the breast cancer has formed inside the milk duct system and has not yet had the opportunity to grow and spread to other parts of the breast or even the lymph nodes.
Okay, and as opposed to invasive?
An invasive or infiltrating cancer, when DCIS is left over time, meaning the cancer is there, it's growing, and nothing has been done to remove it or to retard its growth, then it will become invasive or infiltrate the surrounding tissue and breast architecture and giving it the opportunity to spread to the lymph nodes or other parts of the breast. If you see right here on the chart, you can see the lymph node system, which your lymph nodes are a normal part of your immune system. Their job is to trap bacteria, viruses, and also cancer cells. So when a lymph node becomes swollen, that's something that we pay attention to on a clinical breast exam. And when we were encouraging women on their breast self-exams to check the underarm area, this is exactly why.
Okay.
As far as breast cancer staging is concerned, where you were talking about stage 1, stage 2, all the way to stage 4, when the cancer is confined only to the breast and it's smaller than 2 centimeters in size, that's stage 1.
Okay.
When it has spread to the lymph nodes or has grown larger than 2 centimeters, that's stage 2.
Okay.
And then stage 3 is greater than 5 centimeters with a spread to the lymph nodes. And then stage 4 is a tumor of any size that has got multiple nodal involvements and has spread to distant parts of the body.
Okay, great. Well, Camille, I have learned so much more than I did before. We're now going to go and talk about the different treatment options for when you do discover that you definitely have breast cancer. So we'll be right back.
Now, is this something that you've done for a very long time, or is there something going on that's brought more awareness into your life to make you do it?
I didn't used to regularly do it, but now I do. I have several friends who have had breast cancer or breast cancer survivors. 2 very close friends who are going through it right now. So it has raised a lot of awareness for me and my friends.
I just feel like just
cause you love yourself.
yeah, just feel.
Okay. Well, please, can you promise me today that you'll try, make more of an effort, and even me too, I have to work on that, doing it monthly at least. It's so important.
I would.
Awesome. I'm so glad to hear that. Thank you.
Thank you.
All right, so we're both going to check our breasts more. Not just feel them for no reason. Glad you're doing it. We got to know our boobs, right? Say it with me. We got to know our boobs.
We gotta know our boobs.
It's important to know our boobs.
So we just got finished talking about what breast cancer looks like and benign breasts look like. So now, Camille, let's talk about coverage options. But actually, before we dive into that, let's talk about the different treatment options a person can take when they discover that they do have breast cancer.
So the 3 facets of breast cancer care include surgery or surgical oncology, medicines or what we typically associate with chemotherapy, and radiation. So it's surgical oncology, medical oncology, and then radiation oncology in terms of how we eliminate or destroy cancer cells in the body. As far as surgical options are concerned, there's always going to be the discussion of breast conservation, meaning to keep the breast,
Okay.
with like a lumpectomy or partial mastectomy. Those
Okay.
two surgeries are the same.
And that's just taking part of the boob out where the cancer is.
Yep, part of the breast out. And then you have mastectomy, which is complete removal of the breast.
Okay.
Along with mastectomy, women now are afforded reconstructive options. If they choose to remain flat, that's their prerogative. And it's one of the things that we're proud of here at the Smilo Cancer Hospital, that we do offer individualized care.
Okay.
That we tell you what it is that needs to be done to keep you safe and healthy, and you let us know what matters most to you.
That's good.
Yeah, so what we have been working on as far as mastectomy options, we do skin sparing mastectomy, where we remove the breast tissue that's inside but leave the skin so women can have a natural form or contour look to their breast, and they can choose to reconstruct with either implants, or oftentimes we tell them that they can get that free tummy tuck by taking the fat from their abdomen and using it to remake
I'm sure they like that.
the breast. Absolutely.
And you know what? I like it that you guys really take consideration for the patient, because especially for the woman who hasn't, been married yet, she's thinking about her future and possibilities of her appearance looking different. So I like that.
And the simple way I put it to patients in terms of helping them to arrive at what is right for them is, when you have no reconstruction done to your breasts and your chests are flat, you got to put clothes on every day.
Right.
And that becomes more of a process of making sure that the prosthesis that you're wearing to simulate your breasts, that it looks natural, as opposed to if you've had your breasts reconstructed, you just get up and go. So we do talk to women about those things and other sensitive topics about sexuality, that reconstructed breasts, they have no more sensation. So it's like, in terms of the decision to remove the breast that has a cancer or remove both breasts, that's why I talk about individualized care, because once we help women to understand what that thoroughly entails, then they can come to the right decision for them.
Okay, and then when you do chemotherapy and radiation, is that an alternative to a mastectomy, or sometimes is it both?
It's not. Surgery is the mainstay in terms of most women will have surgery unless they're so old that there are other conditions, health conditions, that preclude them from safely undergoing surgery.
Okay.
And I also want to clarify that while I have gotten into this part of the discussion, once a woman's diagnosed with cancer is usually where I would hand them off to the surgeon that I'm working with in our group. They would perform the surgery, and then once the woman is now free of cancer, we alternatively see the patient in 6-month increments.
Okay, so then you're not actually doing that care process.
I'm not doing the surgery, no.
Okay. And the coverage options, I heard what you said earlier, normally it's covered, the reconstructive, with you guys here at this hospital. And you were saying earlier, I know off camera, Affordable Care Act has good coverage options as well for most people.
So in terms of helping women to understand the burden of cancer care and the costs, we tell them, don't be afraid to come in if there's something that you found, because a lot of hospitals have a breast and cervical program where there are grants that can get the workup done if there's a lump that you feel, to get it checked out to find out whether or not something worrisome is truly going on. And then if you are diagnosed with breast cancer, the care will be covered under that grant. And then other hospitals that receive federal funding, which a lot of them do, are able to offer patients free care options. And then certainly, yes, like you said, with the Affordable Care Act, a lot more women have access to health insurance options that can provide coverage for the care as well.
Okay, so pretty much women definitely shouldn't shy away trying to get treatment due to certain economical situations. They should definitely look into it and see what their options are, and don't just rule it out. So that's good to know. Well, Camille, again, thank you so much for coming on this show today. It was great talking to you, and I really hope that everyone watching took something away from this episode. It's important for women everywhere, and even the men watching, to make sure you talk to your mom, your aunt, your sisters, even your girlfriend or wives about these things. you know, it's a conversation that we need to have more often. All right, so I'll see you all next month, and thanks so much for watching.